So good afternoon, everybody.
Good afternoon.
Yeah, it's a powerful talk by Reverend Barber, as usual, and he's given us some direction. I first want to extend my thanks to the UE Executive Board and the conference organizers for asking me to say a few words and introduce the panel. This is not any convention. This is a UE150 convention. And I call it the feistiest, fiercest, and most focused union here in the South. Right? And I'm not saying that, as a diss to other unions, but if you think about what we've had to work with, the limited resources that people have had, the laws that are against us, right? We stand tall amongst all of those other unions in the South. So proud to be here, right? And part of it is because you got a rank and file leadership from the outset, and you're continuing to develop that rank and file leadership. And it's the formula that we need for the battles ahead. So this is the highest body of the union. It's the most important meeting for your union. And so I want to say it's an honor to be here. And while my union is the American Postal Workers Union, right, for years I've been an associate member of UE150 as an act of solidarity, and certainly want to continue to do that. This morning Gaza gave like a brilliant presentation on this history. And again, if you haven't been in that room, you need to go in there and look at that history. It's really important. And, I'm curious, how many people here were born after 1997? Only one? Just thinking of the years. Right? Think about your ages. Think about the people who have gone, all of us that are aging out that we've talked about, right? But we've been in this fight that long, right? And we've got to continue that fight. The political climate that we're in is dangerous right now. And contrary to what you might hear on social media, it's not about whether somebody stole or Beyonce stole somebody's music. Right? It's not about where Kevin Durant's going to go if he leaves the Nets, or Deshaun, Watson, whether he's going to play football. These are things that are peripheral, right? The issues that we're talking about today are the issues that really face us, and we've got to understand it, right? The powers that be, the right-wing elected officials, the extremists that Reverend Barber told us about, they're pushing, they're on the rise, they're on the ascent, and we've got to be prepared for that. They're prepared to take power by violence. They're supported by right-wing elected officials at all levels of government, county, state, federal. They're white supremacists, and they're armed, and they hate black and brown people. They hate Muslims and the LGBT community. They hate labor unions. And fundamentally, they hate democracy. From the police murders of black people across the country to the January 6th insurrection in DC, the evidence is clear, right? I don't think anybody really has any doubt about it. But it's a question, what do we do about it, right? From the point of view of the workers' movement, workers are fighting back, right? So in this room here, you know the kind of fights that you've been conducting, but we look around us, right? We talked about this morning, and Gaza talked about the Amazon work that the RWDSU has done. Amazon campaigns across the country, a victory in Staten Island. But then there are the Starbucks workers, and I'm understanding that as of, I think, the middle of this week, 200 Starbucks stores have actually organized, right? So they're small units. That's good, though, yeah. They're small units, maybe 15, 20, or 30 employees, but it's the consciousness that they have. Workers saying, we're not going to take this anymore. Trader Joe's, Apple, all these little places. And then there are others that have been organizing. We're fighting back, right? But what else needs to be done, right? And I want to say that our fights are not just with those rotten supervisors and managers that we fight on a daily basis. We fight them, and they're a problem, right? But our problems are also generated by people outside of the workplace, right? In those halls of government, those elected officials. So the question of policy and resolutions that come from governments are something that we have to deal with. The laws, the ordinances that determine our wages, whether we can afford decent housing, or whether we can get decent health care. Those are the things that really we have to fight about. It's not just in the workplace. And you know, in our state, and in many other states too, some union leaders think that we have to limit ourselves to the workplace issues, just in there, but not outside, right? UE has never had that position, and we've got to kind of continue that fight. So what do? Right? We need a program for workers to take into the elections, right? We're coming up, we've actually started the midterm election period, right? And we're going to be going through that all through the fall, and then we've got the 2024 elections. But we need, what did Barbara say we needed? An agenda. We call it a program, right? A program of workers' rights, demands that we are putting forward, right, as we go into these elections. And so the Southern Workers Assembly, back in May, and one or two of you were there at the school that we had, developed a platform, a program that we're calling the Southern Workers Power Program. And you got it in your folders and whatnot. And I think there's even a resolution that'll come up later on about that, right? But we want these demands to find their way into every workplace that we represent, but also workplaces in the area where we don't have any representation, but where we can start to build contacts. We want these demands to be raised at every town hall meeting that the politicians go to, right? When people have these small meetings in churches and other places, we want these demands to be taken there. And there are 9 simple demands, and I say simple, I don't mean that they're not complex or important, but they're demands that relate to our everyday work, right? And we want you to take them out and make it a program. Now, there are a lot of things on there that you may not agree with. There's some things that you may not have considered before. But this is part of the struggle of workers, and particularly Southern workers, right? Fighting for and debating and developing a program for themselves, right? And so what we want to do today is have a panel on a number of the issues that we raised in the platform. We've got, let's see, I don't know who we start out with first. So Medicare for All, one of them, and that's one of the points in our program. Actually, it's number 2. And we're going to hear from Dominique, who's going to talk about the work on that, and then we'll come back around to our next speaker.
All right, how you doing, everybody, again? All right, been my third, hopefully last time up here. So, but I got these buttons for everybody. I'm gonna throw them around and share them with people. So, I just want to tell y'all where we are with Medicare for where we hope to go. See, currently, well, let me back up a little bit, say where we started at. As a union, we've been in favor of a universal health care system ever since the 1930s. UE has gone far back being a supporter of all of these common causes that unite and support the working class, and we've understood for a while that our health insurance or our health care shouldn't be in the hands of our employer, let alone a health insurance company that works like a mafia. So we've been in favor since then, but a few years ago, the Southern Workers Assembly met in Charleston, and that's when we formed our campaign with the SWA, Southern Workers Assembly, and UE, formed our campaign, UE150 specifically, formed our campaign to start pushing for Medicare for All, especially after seeing the nationwide push behind the Bernie Sanders campaign when that was one of the primary points of his candidacy. So we developed a lot of tools. We are united with National Nurses United, united with the Longshoremen, UE National, Eastern Region, and a number of other organizations and unions here in the South. When we formed in North Carolina specifically, we formed the North Carolina Medicare for All Coalition, member association with over 40 different association groups. And we began making calls to senators, laying out the literature for people who didn't know anything about the legislation. Just generally getting everything out that we could to inform people about Medicare for All, what it was, how it is, how it can help them. And not only that, but describing the current system and the inadequacies that it has in it. Like if you get fired from your job right now, you won't have health insurance, all right? If you end up leaving or quitting and want to start your own business, you won't be insured. It's a gap between people who have Medicare and people who are employed that if you fall in between there, you won't be able to get insurance. You work at McDonald's right now, you can't even afford the health insurance that they offer you. I mean, let alone with the wages that they provide. It's just so many inadequacies with the current system, including people who are on Medicare but choose those Medicare Advantage plans, which set elders up to pay substantial costs out of their pockets for the same services that Medicaid provides. So we're dealing with a system that is completely irresponsible and it's just a money grab. So where we are right now with it is it's essentially not going anywhere, even though we have a Democratic president, a Democratic-controlled Senate, and a Democratic-controlled House. Even though we have those three things, it's not going anywhere because the health insurance company has bought and sold key senators to vote in favor of their legislations. So you have, and then in North Carolina, you even have to the point where the ACA and that supplement where we would expand Medicaid isn't being voted on because they give this bullshit reason. They say that they don't want to add to the national deficit, but we know that's a lie because whenever war comes up, it's not one senator or one representative that votes against spending money on that. So it's crazy how we know that you're lying about adding to the national deficit when you're using it to kill people, but not using it to heal people. So we are. So in the midst of like just laying out exactly what they are, exactly what they're doing, and identifying where we at, we need to know where we're going with this. So where are we going? The first thing we need to do is understand that in our system now today, DHHS workers don't have the appropriate amount of personnel to even be able to treat people that come into the hospitals. Yeah. What Medicare for All will do will provide the funding to hire the proper amount of doctors so they will have the adequate amount. You won't have people sitting on the sidelines waiting to receive mental health care because the funding isn't there. You know what I'm saying? You won't have people waiting in these lines to go in the hospital just because they don't have the money in their pocket. What we need to do is get there. We need to keep on fighting, keep on forming together, keep on making sure that people know exactly what we're fighting for. We're fighting for a system that in every other industrialized country is better than ours. You look at every one of the studies that you showed, America finished damn near dead last in all of the essential categories, including maternal health, infant mortality, the way that you feel after you leave from a hospital, surgical results, almost every category we're behind in, and we're supposed to be the richest nation in the world. We got to get this information out to everyone to make sure that they know exactly what we're fighting for. Because it isn't just some Democratic or left wing or pie in the sky dream. It's a possibility because every other industrialized nation has the same healthcare system. All right, so that's where we need to go, and I hope that we all can just get this information to all of our members' hands, use every bit of everything that we learned about Medicare for All, take it back to our unions, or take it back to our chapters, share this information, and then when the time comes for us to get behind one piece that's part of a broader goal, we can get behind Medicare for All as something that we all need to fight for.
That's all right.
Thank you, Dominique. And just want to point out that this program is not the Democratic Party program, and definitely not the Republican Party program, you know that. But until such time as we have a party of our own, we need this kind of vehicle that belongs to us. And we may have to vote for some Democrats in a lot of races. We understand that. But this is a program that's coming from the workers themselves. So next, we want to ask, I guess both Ngaza and Ngaza Laughing House from Refund Raleigh to come talk about police brutality and the struggle for police accountability. And just want to point out that it's number 7 in the program, and you get a chance to look at the program, all right?
It's good to see y'all. Thank y'all for this time today right here. Brother John, can you let me know when I got like 4 minutes left or something like that? I'm gonna try to stay on point with it too. All right, so as I get started, man, I want to say last time I was out here and I went to eat over there at the Franklin Center, and they had these biscuits that were crazy good, man, just as fluffy and buttery and everything. And I took 2 of them, put them together, made a biscuit sandwich, and after that I went to sleep. Y'all ain't about to go to sleep on me when I'm talking right here, right now. I know y'all just finished eating. So I'm gonna start by asking a basic question to y'all, man. And imagine if 20 years from now, police were not gonna be allowed to exist. There were gonna be no more police in 20 years. What would you invest in now to make sure we got community safety? Y'all throw it out there, man. I'm really asking. Like, I would invest in house. I want everybody to have a good house to go back home to at the end of the night. What's some other ideas? What else should we invest in?
Weapons.
Weapons, but what if we want to have safety and peace other than weapons?
$25 minimum wage.
Wages, that's right. What else?
Healthcare for all.
Healthcare for all, that's right. I would invest in parks. I want my kids to have a nice, safe park to go home to. I would invest in repairing hazards in the city. I would invest in mental health services. I don't want people walking up and down the street going through mental episodes and nobody to turn to. So there's all these things I would invest in, that we would invest in, and it almost seems like a fairy tale world that we're creating too. But that's right. Now when we think about who provides all these things, workers, that's right. Who provides clean neighborhoods? Y'all do. Who provides and maintains our parks and campuses? Y'all do. Who repairs our schools and makes sure our after school programs? Y'all do. That's exactly right. But the budget in a lot of our cities and towns does not respect y'all, put the value on y'all that it should. Meanwhile, we know that workers got the power to shut down a whole city, don't it? Imagine if in Raleigh, our brothers and sisters at the sanitation department said, ain't not one truck leaving this yard like they did in 2007 until we get some adequate breaks, until we get hazard supplies, until we get hydration supplies. The city will have it to you ready in 10 minutes, like Little Caesars out here, wouldn't they? Because we got that kind of power, but the budget doesn't reflect our value, and our power doesn't reflect some of our action in this place. We should be organizing like we got the power to do it. And as I'm talking about police, I want to stop for a second too and talk about how it is that police are allowed to treat our people, working class people, white working class folks too, but black people in particular, they're allowed to treat us in ways and get rewarded for it. Yeah. Ways that would never be tolerated if they treated white folks like this. And I'm not even talking about the big, huge national cases. I'm talking about the micro interactions that we have with police, because one interaction with the police can ruin your whole day, can it? You look in a city like Raleigh. A city like Raleigh is 29% black, 55% white, but when the police are stopping drivers, 59% of the drivers they stop are black. 59% of the drivers they search are black, even though they find illegal items on white folks at the exact same rate, yet they target our people, and in response, the city gives them an extra $5 million every year. How does that work? I see Charlotte right there on the wall right there. The city of Charlotte is 35% black, 46% white, yet 51% of the people stopped and searched while driving are black. And in response, they get rewarded with a $285 million budget. How does that happen? And we see these trends throughout North Carolina too. Now this is bad police work. This is piss poor police work, yet they get rewarded for it. What happens on our jobs if we do bad work? We get fired. What happens if the brothers and sisters who collect recycling, if they choose to collect recycling differently in one neighborhood than another, just because one neighborhood is black and another is white, what happens to them? What happens if we repair the roads differently in one neighborhood than another so that it benefits one race but harms another? What would happen to us in this situation? We would get fired for it. But what we see is police can do a bad job and get millions. We do a good job and get pennies. So the question is, what you gonna do about it? Strike! Strike, that's right, that's right. So when we look at these police budgets, and I'll stop at this right here, but when we look at these budgets, we see that these cities have enough money to provide us with everything that public workers need. They got enough money to make sure every worker gets a living wage, 22 bucks an hour, instead of giving us pennies like they give us in Raleigh. We see there's enough money to buy all the safety equipment that brothers and sisters need out here. There's enough money to pay all the overtime hours that they owe our people. So when you hear people saying divest from police, when you hear us at Refund Raleigh talking about divested from police, we're talking about reallocating money from these big, huge, swollen police budgets and putting it back into the things and the people that make us safe. That's y'all. Thank y'all.
Yeah, thank you, and guys, perfect timing too. So next, we're going to deal with, our cast is going to come up and talk to us about housing. And just so you know, housing is the number 3 point on our program.
Good afternoon, everyone. Here to talk about the North Carolina affordable housing crisis. Across North Carolina, there's a shortage of rental homes and affordable homes that are available to extremely low-income households whose incomes are at or below the poverty guideline of 30% of that area median, the AMI. Many of these households are severely cost-burdened, spending more than half of their income on housing. Severely cost-burdened poor households are more likely than other renters to sacrifice other necessities like health, food, healthcare to pay for their rent, and to experience unstable housing situations due to evictions. The construction of affordable housing has been chronically underfunded and regulated by racist housing policies. What you need to know is between July 2020 and July 2021, 31,381 people moved to Charlotte, the Charlotte area, putting a strain on household resources. In North Carolina, if your lease expires, there is no limit on the amount a landlord can raise your price to on that unit. Now that COVID eviction moratoriums in North Carolina are gone, landlords are looking for payment. They want that payback, the money that they lost during COVID, and can raise rent prices to capitalize on the demand of those rentals. In North Carolina, landlords must provide a 7-day notice for any price increase for tenants who have a month-to-month rental agreement. But we all know that 7 days is not enough time if they're going to raise your rent. If your lease expires, there is no limit to the amount a landlord can raise the price of that unit to. Housing is one of those areas where you're just seeing the cost ratchet up. For those who are doing well in the economy, that's fine. But for those who have the kind of jobs that don't see a lot of pay increases or bonuses, the people that are fighting for a living wage of $15 per hour, those folks are being left behind. Generally, housing is deemed affordable when it comprises of no more than 30% of the household budget. I lost my place there. For most matrix, that includes mortgage plus rent and utilities. According to the North Carolina Housing Coalition, more than 25% of all households in the triangle do not meet that criteria. That means that more than 170,000 households in Wake, Durham, Orange, and Johnson counties face a cost burden to just put a roof over their heads. We're not even talking about eating, health care expenses, child care expenses, or anything else. It's easy to look at the housing cost as the culprit, and certainly it is a contributing factor, but household income plays an equally important role. After all, if income growth outpaced the even faster growing market, households would not feel the pinch. In the triangle, household incomes have increased by about 18% since 2011. That's less than 3% each year during the time of massive economic expansion. For comparison, the S&P 500 stock market index increased by 158% in that same time frame. The majority of economic gains have been concentrated to the upper ends of the income spectrum, widening the income inequality. In all, the resources are going to the top and none are staying at the bottom. So what does that mean for the future in society? What it means is severe housing problems. Housing influences health and well-being. The lack of at least one basic household necessity, like a bathtub, shower, sink, faucet, stove, or refrigerator, have even higher rates of being underinsured. Poor quality of housing can cause disease and injury, affect a child's development, while other housing-related factors such as neighborhood environment, overcrowding could lead to mental health issues, physical health problems. Housing-related factors and their associated health consequences include but are not limited to affordability, cost burden. Families may have difficulty affording other basic needs such as health care, food, heat. Individuals who have difficulty affording housing were more likely to report fair or poor health conditions, chronic conditions, not being able to pay for their prescriptions due to cost. Housing has become less affordable over time as rentals have risen more quickly than incomes. Who is affected? While anyone who lives in the home with conditions that threaten health, those with greater risk of experiencing housing-related health conditions include low-income families, racial and ethnic minorities, children, and older adults. What works? Evidence supports various interventions to prevent minimize the impact of housing problems on health. Healthy homes programs at state and local levels have been founded to improve health by remedying unhealthy housing conditions such as lead, inadequate ventilation, and excessive moisture and mold. Increasing affordable housing options through local and national housing development policies, along with rental vouchers, subsidized housing, and utility assistance programs can help cost-burdened individuals afford housing. More collaboration between the housing and health sector is needed to be promoted for a healthy home and environment. Better integration of healthcare in the housing system, particularly with those with chronic needs. And also, the most important thing is to pay people a living wage. And that's why it's so important in the work that we're doing to organize to make sure that workers get honest days pay for honest days work. Because we're suffering across the board because of it. And so I'd like to thank everyone in this room for your participation, your time, and just moving forward. Thank you.
Yes, so next we're going to have Michelle Dunlap speak on attacks on civil rights, health, and overturning Roe versus Wade. And again, just for your research. It's number 5 in the program.
So much. Thank you, sir. Good afternoon, everyone. Clap one time if you can hear me. Clap 2 times if you want to hear me. All right. I am Nichelle Dunlap Thompson. I am part of Charlotte City Workers Union. And I am honored to stand here before you to speak on the civil rights, attacks on civil rights and health, overturning the Roe v. Wade. June 24th, 2022 will now go down not as a day of infamy, but the day that every woman in the United States was raped by the United States government. The United States government took a piece of our bodies that belongs to us. Every one of 6 women have been a victim of sexual assault. Somewhere right now there is a young girl. There is a woman who is being attacked by someone that they more than likely trusted and thought were a friend. Or there is a woman, a young lady somewhere that is terrified for her life and alone crying out for help, praying that this nightmare will end, or even that it is just that, a nightmare. A cruel dream that she wants to undoubtedly to wake from and go back to her nice bubble of normalcy, but that will soon fade away. Where is the government? Why are they not able to protect this young girl, this young lady, from being annihilated emotionally and destroyed physically? Where are they? If they are not there doing the terror, what gives them the right to oppose on what happens to a woman's body as a result from that terror? Almost 50 years ago in Texas, the United States Supreme Court understood the importance of passing Roe v. Wade, protecting the reproductive rights of women and their freedom to choose whether to carry a child to full term or to end its life prematurely. Women still are carrying babies. The rights we deserved and needed in 1973 still carry the same significance, and the need is still a priority in 2022, if not more. Assaults and attacks on women have not stopped. Babies who have medicinal challenges are still placing a physical, emotional, economical challenge to the mothers, the parents as a whole. If you are incapable of creating life, then surely you don't have the capability to decide what happens to a life that you held no power in creating. As a woman, deciding what is best for our bodies, for our families and our households, is a stressful ordeal by itself. Adding restraints and barriers that stem from a group of mostly white men who hold no knowledge nor capabilities to create a life is more piercing than the knife that they just stuck in our backs. In the US alone, there were a total of 630,000 abortions in 2019. Imagine how many of those women would have died if there were no safe facilities, qualified licensed physicians to conduct those procedures. If these procedures are not monitored by licensed individuals, then we face threats like no others against all women and young girls across this nation. And a few of those threats will come in the form of higher mortality rates of young women, decrease and decline of morale of women who have no outlets after an attack or a sexual assault, increase in emotional trauma of women and the children connected to those women, a rise of need for health care for those women who are severely injured while seeking a black market abortion, threats to the woman's future reproductive chances due to injury that she endured on her internal reproductive organs, which further threatens the structure of our family unit. If man had no presence nor impact on the prevention of the attack, then they sure as hell have no place with the decision-making process when it comes to deciding what happens to the body of a woman after the attack. I charge this union, this 20th day of August, in the year of 2022, to continue to fight alongside us to declare our bodies sacred. And the decisions that are made concerning our bodies are just as sacred. Roe v. Wade has been overturned, and now it's our turn to shift our votes, raise the volume on our voices, and create the type of good trouble that I live for. Let's continue to fight. and turn this right back where it belongs, in the hands of a woman and not a man.
Thank you, Michelle. I just want to add, I said there's going to be a resolution on supporting the Southern Workers Assembly and supporting this program. But before we get to that, I want to point out that these are the kinds of conversations we need to be having at home, with our families, with our neighbors, with people in our churches, mosques, and synagogues, right? Everybody needs to be taking these questions up. So it's not just, as part of our union work. It's not separated. It's something that we do as part of being citizens out there trying to make a change for the better. So our last speaker is going to be Ajamu Dillahunt. That's not me. And he's going to talk to us a little bit about the Communiversity project and the webinars they're going to be holding to deal with this program in the coming months.
Good afternoon. Good afternoon. I know it's been a long day, but I'm Ajamu Amiri Dillahunt, and I have the honor of helping lead the Communiversity with Mama Shaf there in the back. We're a community-based archive and educational institution in Rocky Mount, North Carolina. We have records on the Black Freedom Movement and Workers Movement in North Carolina from the late 70s on to the present day. And so as part of an educational institution and commitment to not only the history of the workers' movement and preserving it, but being in close proximity to the current workers' movement, we've been in a study group with Abdul Akali Mad, who's on the SWA. And out of that study group, one of the things that has come out of it is to really help the 9-point workers program come to life, to do education around that. And not just hosting webinars, just to have webinars that, the usual suspects are on, but to have webinars that center the Southern worker perspective. And so looking at these 9-point programs, we hope to have workers talk about how, of course, the right to collectively bargain impacts them, to talk about how the question of militarization impacts them, how the question of healthcare, housing impacts them, so workers can hear from other workers. So we're encouraging and hope that the union will take it in base areas and pass it out and encourage workers to attend these webinars that'll lead up to the election. It'll start in September and will be weekly until the November election to make sure that we hit all 9 points. So that's one thing about the Communiversity that I wanted to mention. More information will be sent out. We'll send it to Sister Sakia, Dante, and other Elder Ngaza and other union leaders, so that chapters and others can have this information and mobilize for these webinars.